Hey nursing students, so I've got a question for you and I need you to be honest with yourself. So if you sit down to study for your next message exam, your pathophysiology test, your anatomy and physiology test, how are you planning to study? Are you planning to read chapter 22 from the start to the end? Or are you planning to use color-coded pens to write stuff down or just highlight half of the book until it turns yellow? If this is you, then I need you to listen clearly now. This is hard, but let me tell you, nursing school is not a memory test. It is an application test. The world does not need nurses who can memorize a textbook. The world needs nurses who can walk into a chaotic room and see that a patient is crashing and know exactly what to do first. All the nursing students that you see, they graduate with top grades and they find a job even before they graduate. They are not geniuses. They are not better than you. They only find a study plan that worked for them. And this is what I have used to be able to stay on top of my class and also progress when I graduated from university. And today's video, I am walking you through the exact framework that nursing students use to stay on top of their class and even do well after graduating from nursing school. So let's in section 1, we are going to talk about the problem. So why are you forgetting? Before we even fix your study or work around your study techniques, let's look at why you are not remembering anything. Most nursing students open a book and they start reading from top to bottom, word for word. This is linear studying. If you study this way, you are only, your brain is going to make a list of memory. And when you go into an exam or when you go on a placement and you get a story about a patient which is not presented in a list form, your brain starts to panic. But what you need to understand is nursing is not linear. The human body is not linear. Your patient with heart failure will not present with a neat list of symptoms. They will present with shortness of breath, anxiety, and even swelling. All comes together at once and you have to deal with it. But if you study in a list form, your brain will tell you, okay, I know the list of the symptoms, but I cannot recognize the story. This is where you freeze in an exam or even in a placement when you are asked to do an episode of care. So what you do here is to try and learn the mechanism of what happens in the body. So in the process where your brain recognizes the symptoms, a list of symptoms, but not recognize the story of a patient, and then you freezing, is called passive learning trap. Smart students don't fall into this trap. Why? Because they make a connection with whatever they have learned. This will lead me to my next point, which is the foundation. So if before we even talk about your study techniques, let's understand the foundation of all nursing knowledge, which is the pathophysiology. At this point, pathophysiology is king. Before you even do anything, you have to understand the mechanism, what is happening in the body. If you don't understand what happens in the body, you will be drowned in the details. Let me prove this to you. Let's say take vomiting, the act of vomiting alone. If you learn a list of symptoms, you will understand that vomiting causes dehydration. You will understand that vomiting causes low potassium. But if you understand pathophysiology, you know this. If you vomit, your body expels gastric acid, which is rich in hydrogen and chloride. Now, when you lose acid, your body becomes alkaline, or your blood becomes alkaline. This is metabolic alkalosis. Now, in time to compensate for this, your kidney will try to fix this by dumping potassium into your blood to hold on to the hydrogen. This is where you lose more potassium. Then potassium becomes low. You see the difference? So if you learnt the list or signs and symptoms, you will understand that vomiting causes low potassium. But if you learned the mechanism, you understand the pathophysiology and you know how to connect things together. Here is your new rule. For every disease process you study, try your best and answer one question. What is the mechanism? Why is this causing this symptom? If you can answer that simple question, then you do not need to memorize a list. You can reason your way through the answer. This can be a placement, this can be during your OSCE exam, this can be when you are writing an assignment. You can do this. Now, let's build the actual study cycle. This is a 4-step process that every nursing student that stays on top use. The first one will be prime, the second will be encounter, then recall, and we have connect. So if we take it one by one, the first one is priming. This takes about 15 minutes. So before your lecture, say on diabetes, I don't want you to learn anything. Just look at the topics or look at the headings, just skim through it. Just glance through the diagrams and just tell your brain that tomorrow we are learning about insulin and glucose. You are not learning anything at this point. You are just telling your brain that tomorrow we are learning about insulin and glucose, so get ready. This forms a mental filing cabinet in your brain to get your brain to be ready for the information it is about to receive. The encounter. This is during class. So during your lectures, please don't be a transcription robot. Don't write everything word for word, because this is not going to help you. But what you need to do is listen attentively. Whenever the professor mentions any story about themselves, the patients they've had before, stop and write this. Listen to when they connect the dots. When the professor mentioned that this is a common mistake on the exam, just stop and write this down. And just be attentive to whatever, and I will repeat, whatever story they tell about their own patients. These are what is going to come in the actual exam. And these are the memory your brain is going to hang on to later. Now, the recall, the 24-hour rule. This is the most important point, but this is the 90% of students skip. During your lecture, say within 24 hours, close your book and do not open your lecture notes or your textbook. I want you to find a plain piece of paper or sheet of paper or a whiteboard and just write whatever you can remember from the lecture from your head. This is called blurting. Just dump everything you can remember on that piece of paper or the whiteboard. We'll see is when you want to do the diagrams, when you want to write about the medications, your brain can do a lot. And at some point, you will feel like you've hit a wall and your brain will be like, that's it, I'm not doing it again. This is good. That is the moment where you are learning. You see that mental friction in your brain, the cognitive friction. This is where you are learning. It is forcing your brain to push information out, and this information is going to stay in your brain forever. So what you will do at that point is, if you can't remember, don't worry. Just close your book, mark yourself. Now, go back and open your book, read that question again and put the answer in it. What I do at this point is that I will use a red pen to fill in the ones that I didn't get right. And it doesn't matter if you feel like you don't like the idea of using red pen in your book. You can use other alternative colors to write the answer down, and that you have got that piece of information, and this will stay in your memory forever. Now we have to connect all the information that we have learned. This is the concept map. You don't have to make a linear list of whatever you have gathered. You have to make a map. Just connect it. So let's say you take something like diabetes, you put it in the center and you connect it with the pathophysiology. What is happening in the pancreas? Now you connect that with the signs and symptoms. Why does somebody get thirsty when they have high blood glucose? Is it because your blood is getting too concentrated? Now you can then connect that again with nursing interventions. You can connect that with poor circulation and neuropathy. This is what you are going to do. And then also you can connect that with the pharmacology aspect. So things like type of insulin, what they do, and the effects they have on the human body, and even you can connect it with why and how they cause hypoglycemia. So when you have finished all of this and you've connected this together, you will see that you've got a giant web of diabetes, pathophysiology, and the whole disease. Now your brain will go into that giant web because it is going to mimic how your brain stores information. So whenever you get a question which is very tricky, or a question which is very hard and not so easy, your brain can then travel into that web and then source that information to be able to answer that question. Now, here is the secret that separates top students from the rest. Top students don't just test themselves with questions or practice questions, they learn them. Most students will save practice question all the way to the end or day before the exam. They cram and then go through the exam questions or practice questions and then see that they've got 70%. Then they panic. A top student will start from day one and study practice questions. They learn them so that when it comes to the time of the exam, they know what they are doing. So here's the catch. I want you to do is, from day one, when you learn any new topic in nursing, just start with practice questions. Learn the practice questions. First of all, you will answer the questions and you will not get them correct. That is fine. This is good because this is where you are going to learn. What you've got to do is, the questions you've got wrong, go back to them, look at the rationale. Why did you get the questions wrong? What is the answer looking for? Have you just bullet point or list things? Have you gone through the mechanism of the process and have you used that to answer the question? If you do that, you will see that you are getting the understanding of the questions, and when you go to the exam, you will see that you've not met new questions, you've met old friends. So what I want you to do is three things really. So when you answer the questions, I want you to do the analysis. So this is your task to do. First, think about, did I get all the facts or did I forget some of the facts of the answers? This is a memory issue. And let's say if you did not understand the concept, this will be a knowledge gap. And we are going to fix this in the next video that I will post. When you look at all of this and you see that this is what I've done, my problem is at the memory because I don't understand the facts or I don't recall the facts. This means that you can create some flashcards to serve as cues for you whenever you are doing such problem. As I said, I don't want this video to be too long. So to wrap up everything, we talked about the problem. We talked about the foundation of all knowledge. We have talked about the top nursing school cycle. And then we've talked about how to connect everything, and then we've talked also about how to treat practice questions. Now I'm gonna say nursing school is very hard. It is meant to be hard because you are dealing with real people, but you can do it. All the nurses that have done it were in the same shoes and they were able to do it, so you can do it. I will see you in the next video. Stay tuned. Bye.